Hello. The Divine Code for January 10th, pages 433 and 434. We're in the chapter The Laws of Intentional and Unintentional Killing and Killing Through Negligence or Under Duress. Topic number 9. Even if one has permission to hit another person, see chapter 6 below. That's the next chapter that talks about injury. Such as a parent who may discipline a child, or a teacher who may discipline a student. This can only be a small blow in a way of rebuke and teaching. But if a Gentile parent hit and injured his or her child, who then died as a result, or likewise, if a Gentile teacher for a Gentile teacher and his or her student, it is considered intentional murder and liable to capital punishment because the person should have been more careful. So we have in the air, as far as discipline is allowed and corporal punishment, but corporal punishment, we have the whole range of what is hitting. And if a person hits in this range over here, they can be for discipline. Spanking a child is for discipline. Person hits in the range way over here, then the person is possibly going to kill the victim. So there's a whole section in between, which is a gray area. So when doing corporal punishment, it's necessary to be way in the side of not causing injury. If causing injury is the area in between, that would prevent a person from going to the side where the punishment can lead to the death of the person. As long as we're over on this side, we're safe, and it can be positive for the sake of the child or for the sake of the student. And there's a long area in between, so we don't have ambiguity in that regard. The child dies unless it's a freak accident, but if the child dies for serious beating, then that would be considered murder and be liable in a court of law. See Tosafot Bava Kama 9:3. If the youth was hit more than he could bear, the father or teacher is liable. As it says in Rambam, Laws of Murderers 2:14. This is explained in Tajbats, Volume 3, Chapter 82, that a teacher or doctor who intentionally injured more than is required to accomplish his or her permitted goal is liable for capital punishment. So that also with the teacher, in this case, beats one of his students more than is reasonable. A little corporal punishment can help with the teaching, but if it's done in a vicious manner, then the person's no longer excused as that they're just disciplining the person. There's an acceptable area of discipline, and that's way over on one side, where it's not going to hurt the person. For example, if a father is teaching a trade to a son, or a teacher is teaching a pupil, and from time to time the student is struck in order to make him behave and learn, then if the son or pupil is killed completely unintentionally, the father and the teacher are exempt from going into exile, and the blood redeemer has no permission to kill them, since they are involved in carrying out the good deed of educating the child. See Rambam, Laws of Murderers 5:6, who says to chop wood. That is a permitted act. This comes to exclude the father who strikes his son, or a teacher who strikes a student. So chopping wood is permitted, it has a productive value, and similarly, disciplining the child or the student has a productive value. Therefore, it's allowed up to a certain point. For the okay, so in this case, if the parent or the teacher unintentionally killed while performing a commandment, they're performing a commandment. They're doing something productive, such as chopping wood be for something productive. It appears that this applies to Gentiles as well, since in such cases as these, they are doing a positive action that they are morally obligated in, although not a commandment in the Torah. And therefore, when an accident is involved, it is considered unpreventable. So obviously they're doing something. There's a extra allowance given that if the spanking the child somehow kills the child, and it's not a heavy spanking, it's within the realm of reasonable punishment, but somehow it inadvertently killed the child, that would not be considered negligent in a normal case. There's a leniency given. There's a benefit of the doubt given to the parent or the teacher in a normal situation. This also appears to be the opinion of Tajbats, cited above, who equates a doctor who accidentally killed to a father or teacher who killed while teaching, to show that even a doctor who is not obligated by strict Torah commandment to help, but is only doing so as a good action, is exempt as he kills a if he kills a person while giving him medical help. So the concern here is that in the Jewish law is based on the parent is doing a commandment, the teacher is doing a commandment, the doctor is doing a commandment. To be a parent, to teach, or to heal, those are commandments within the Jewish law. It's not necessarily a commandment within the Noahide law. It's more under the realm of moral obligation. So what's being said here is that the moral obligation that a parent, a teacher, and a doctor has is sufficient to bring this allowance into effect for the sake of these three categories. This could happen, for example, if the father or teacher mistakenly uses a larger stick than is appropriate. So let's say they're using a stick that they think is okay. Turns out the stick has a poisonous thorns on it that winds up hurting the child and killing the child. It wasn't expected, and the benefit of the doubt is given to the parent or the teacher or the doctor. The doctor makes a mistake. We'll go more to the doctor in the next part here. Topic number 10. A doctor who has official permission to heal. The Shokanoric Eurydeia, chapter 336. So he's a licensed physician, or he is recognized by whatever community recognition there is for a doctor. This isn't just someone just doing this, but the person is recognized as a healer by whatever recognition is used. Who is trying to save an unhealthy person. I would suggest also a nice passerby who tries to help somebody. Well, you have to be careful, but allowances are given in that case too by society. But this is specifically a licensed physician who was trying to help to save an unhealthy person and yet gave treatment that killed the patient. So that happens a lot also in medical. Many of the medical drugs, medicines that are given are actually poisonous at the same time. They're poisons that help the person. So the doctor, there's always a risk of doing something that might kill the person. He has not committed an unintentional murder, but rather unpreventable murder, since he is trying to save the patient. Even if it is known that the correct medical treatment has a risk of death for the patient, for example, surgery, the doctor still has responsibility to try and help, and therefore he is not called a murderer for using the treatment. This only applies to a treatment that is generally given for a particular medical condition. But if the doctor gave the wrong treatment due to bad diagnosis of the disease or assigning a wrong treatment, this would be in the case like malpractice, he has committed unintentional murder, and the Torah's permission for a blood redeemer applies. Tashbaz, Volume 3, Chapter 82. Since the doctor should have paid better attention. Shulchan Aruch Yoreh De'ah 336. The statement there regarding a Jewish doctor, if it is known to him that he erred and killed, he must go into exile, means he knows that he gave the wrong treatment. But if the professional assessment is that he gave a reasonable treatment, he is not to go into exile. And this is clear in Berkit Yosef Yoreh De'ah 336 6 and Shulchan Aruch and Aruch HaShulchan in Yoreh De'ah 336 6. So this happens a lot in medicine. Unfortunately, there's a lot of ambiguity in medicine, and our medical establishment they don't give the amount of time that should be given. We're, as a society, at least in America, we're not putting the resources that need to be put into for medicine, and doctors don't have the time. They don't have the resources available oftentimes to give a correct there's a certain fog that the medical system is working in, and this is the way it's licensed is working within the fog. So what's acceptable probably should not be acceptable, but what's acceptable in our society is that a certain amount of misdiagnosis that does occur, and it's part of the system, and a doctor working within that system, he's functioning within the system that exists. Now we could fix the system, but we would not necessarily, unless in the case of gross negligence, be attacking the doctor. And unfortunately, that happens. Technology is advancing so quickly that wisdom hasn't reached up to it, and the default is to give leniency to the doctor in these cases. We have to be able to give leniency to the doctor until things catch up, until practice catches up with our new technologies, and the doctors are able to spend the time necessary to properly diagnose patients. This appears that this is only the case if he killed with his hands, like one who incorrectly performed a surgery. But if the doctor administered wrong medicine, in the instance of indirect murder, as explained in Topic 1.7, Chapter 1, Topic 7, and the blood redeemer has no permission to kill him. See Tabaz. And Berkit Yosef Yoreh De'ah 336 7, who leaves this undecided. The discussion applies only to someone who did this unintentionally. If it is done unintentionally, he does not go into exile. So this is where we're applying strict Torah law. If he directly did something, in this case, it's a little different than if he indirectly did something. If he directly did something through surgery, he's trying to, fix the gallbladder or something, and the cutting actually killed the person. Versus if he gives the wrong medicine and the person, that there's technical differences that may or may not apply in the way we're applying it here. And we're dealing with allowances given, leniencies given to the doctor, which goes into rabbinic decisions. That once we have rabbinic decisions, there's a certain amount of logic that applies rather than simply doing what the Torah says. And whether or not it applies to Gentiles brings it more into following logic. So they're leaving it undecided at this point. That's where it needs to be. The local based din, the courts, the government that's doing licensing and regulating the medical system has to be the ones to make the decision for what makes sense in their time and in the culture. However, if this doctor is not licensed, or there was a more competent licensed doctor available. So when we're saying license, it doesn't mean that he has all the paperwork. It means that he's recognized and he's qualified. You could have a licensed doctor who's completely unqualified. So this has to be parsed out. We have to understand if you could say if the person was not recognized as a doctor and he's doing surgery because he figures he can do it, that person would not be the person being given the benefit of the doubt here. If anything, that person would have a stricter ruling. And he caused death. So the unlicensed or unqualified doctor causes death, even if he only wanted to help the patient. This is an incident that began with the negligence of not leaving the treatment to a certified doctor, and even if it is unpreventable, in the end, he is liable to be sentenced for murder. This is the implication of Shulchan Aruch Yoreh De'ah, chapter 336, which states he is considered a murderer, and this is also mentioned in Shulchan Aruch Yoreh De'ah, chapter 336. I'm sorry, this is also mentioned in the Aruch HaShulchan Yoreh De'ah 336. So this doctor, he's not qualified, but he wants to do the medicine anyway, and he should back away unless you're in a difficult situation. It's an emergency situation, and he's the only guy. He's a foot doctor that is now being told to do brain surgery. He's not qualified to do it, but there's nobody else available. Then an allowance would be given for him. But if there's a brain surgeon in the town and he's a foot doctor and he's doing, they need someone to do brain surgery, you let the brain surgeon do it. You don't have the person that, you have to. A lot of this depends on the local situation, and we are assuming that there is a qualified doctor, a specialist in the area that needs work, not a person that, and therefore if a person is unqualified and he should know better, if that person does it, then he would have a liability. Even if he intended to help the person, but it's gross negligence at that point, then it's almost intentional murder at that point if something goes wrong. it's that in between zone that goes towards a liability of, even though he didn't intend to kill the person, it was a hyper gross negligence that goes to the point where it was inevitable. You know, the foot doctor that tries to do brain surgery, it's inevitable that the patient's going to die, almost inevitable. So therefore, he should not have done it, and that would be a liability in court. It need not be said that if a doctor killed on purpose through a hands-on treatment, that he is considered a murderer. So there's no allowance just because the person is a doctor. He's not getting the permit. He's not given the leniency because he's a certified doctor. He's given the leniency if he's a certified doctor who is behaving like a certified doctor. Therefore, yeah, he doesn't just get a doctor's, you know, like you get a doctor's parking permit that allows you to park closer to the hospital. You don't get a get out of jail free card because the person's a doctor. If he kills someone in a in a purposeful or near purposeful manner, then that leniency does not apply, and he would be liable in court. Thank you.